Miss Phillips? Hey,
Hi.
just follow me to this room. You can have a seat. My name's Megan. I'm going to be your nurse today. I'm just going to ask you a few questions and then we'll start the exam. Is there anything that I should know? Are you in any pain right now? You're not in any pain. Okay. As you can see, when I walked the patient from the waiting room to the room, I actually assessed her gait to make sure that she was coordinated, which she was, and she had a good balance and a good walking posture. Okay, can you give me your date of birth?
050494.
Okay, so you're almost 21.
Mm-hmm.
Alrighty. Okay. And just as I was introducing myself, I actually looked at the patient's skin, and I can see that she has a normal skin tone for her ethnicity. Okay, so you gave me your date of birth. Can you give me your full name?
Cassie Mullane Phillips.
And you know where you're at today?
Yeah,
Can you tell me where you're at?
the doctor's office.
Okay. The patient is alert and oriented times 3. The patient denies pain. The patient has good mobility as evidenced by the walk from the waiting room to the room. As I've already said, her skin color is normal for her ethnicity. Okay, I'm just going to check your skin. Do you have any issues with your skin? Okay, I'm going to check the patient's skin turgor. The patient has good skin turgor. She's not dehydrated. Okay, and also, as I was doing this, I'm going to look at her nails to inspect for any discoloration. Well, she's got her fingernails painted, but you can still see the tips of the nails to make sure she doesn't have any curving or chipping of the nails, which could evidence further illness. She also doesn't have any edema noted to her arms or her hands. She has no lesions noted to her skin on the arms. Okay, I'm just going to take a look here, if that's okay. No lesions on the stomach. We'll get to the back later. No lesions on the feet. Okay. I'm going to check for edema to her feet. No edema noted. Also, capillary refill is less than 3 seconds, which is good. No edema. Okay. Pulses are palpable bilaterally. Okay, now I'm just going to look at your head and your neck. Have you had any issues? Have you felt any abnormal bumps, open areas?
No.
Any of that?
Mm-hmm.
No. Okay, I don't feel any abnormal bumps, lesions to her head. Okay, I'm going to press on your sinuses. You may feel a little bit of discomfort, but it shouldn't be a great deal of pain. Okay, so I checked her frontal and her maxillary sinuses. Okay, can you open and close your jaw for me? Okay. So I inspected her jaw to make sure she doesn't have any type of locked jaw or anything like that. Okay, now I'm going to palpate her lymph nodes. You kind of press with one side to see if you feel a bulging on the other side. Lymph nodes feel good. So now I'm just going to listen to I'm going to start here with your neck and listen to your pulse, and then I'm going to listen to your heart and then your lungs, okay? And you want to listen with the bell of your stethoscope. At the base of the neck first, you put light pressure. And then at the midline here. And then at the angle of the jaw. Okay. Now I'm going to listen to your heart. You're looking for the right ribs. To find first your apical. And then your pulmonic. Erb's point. Tricuspid. Okay, heart sounds are good. No murmurs noted. So now I'm going to listen to your lungs. So when I place my stethoscope, if you'll just take a deep breath in and then exhale. Okay. Okay, now if you'll come with me over to the exam table. Okay, you can just lay down and make yourself comfortable. So I am going to look at her stomach. Okay. You don't have to actually get the picture. It's okay. Alright. So I'm going to look at the skin of the stomach. Make sure there's no lesions, distension, any abnormalities. There's none noted. The contour, you want to make sure that one side's not distended over, which could indicate a bowel obstruction or anything like that. Okay, then you're going to ask, do you have any tenderness in any part of your abdomen?
No.
If you did have a tender area, then you would want to make sure that you inspected that area last. So now I'm going to listen for bowel sounds. And you want to listen to all 4 quadrants for 1 minute each.